This presentation is about chronic inflammation. What is chronic inflammation? Chronic inflammation is a prolonged state of inflammation in the body that lasts for weeks, months, or even years. It is a response to a persistent stimulus such as an infection, injury, or autoimmune disorder. Characteristics of chronic inflammation. Persistent inflammation, increased production of inflammatory mediators, accumulation of immune cells, and tissue damage and fibrosis. Symptoms of chronic inflammation include fatigue, body pain, depression or anxiety, diarrhea or constipation, weight gain or loss, or persistent infections. When you're living with chronic inflammation, your body's inflammatory response can eventually start damaging healthy cells, tissues, and organs. Over time, this can lead to tissue damage. What causes chronic inflammation? Long-term exposure to irritants like industrial chemicals, pesticides, or polluted air, an autoimmune disorder, the immune system mistakenly attacks healthy tissues leading to chronic inflammation, untreated causes of acute inflammation like an infection or injury. Other factors that can contribute to chronic inflammation would include smoking or tobacco use, chronic alcohol intake, high levels of stress, age, and obesity. These issues don't always cause chronic inflammation in everyone. In some cases, they don't have a clear underlying cause. How is it diagnosed? There are no real tests to diagnose chronic inflammation. Many people don't know that they have chronic inflammation until they are diagnosed with another condition. A C-reactive protein or a CRP blood test may indicate inflammation or infection. A blood test can identify inflammation in the body, but it doesn't determine the cause of it. How is it treated? NSAIDs like aspirin, ibuprofen, and naproxen can help reduce inflammation, but long-term use can increase the risk of peptic ulcer disease and kidney disease. Steroids can decrease inflammation and suppress the immune system, but long-term use can lead to vision problems, high blood pressure, and osteoporosis. Supplements like fish oil and even some spices like ginger, garlic, and cayenne may help. Lifestyle changes like losing weight, increasing physical activity, and dietary changes have been shown to lower inflammation. Foods to eat. Olive oil, leafy greens like kale and spinach, tomatoes, fatty fish like salmon and sardines, nuts, fruits like cherries, blueberries, and oranges. Foods to avoid. Refined carbs like white breads and pastries, fried foods, processed meat like hot dogs and sausage, red meat, and sugary beverages. In general, to avoid chronic inflammation, aim for a diet that is high in whole foods and low in highly processed foods. Engage in moderate exercise, get quality sleep, manage stress, and if you smoke, you should quit smoking. And here are my sources.